Health officials are issuing a new warning as more than 3/4 of the nation's pediatric beds are full. Hospitals are reporting a surge in patients seeking urgent care, and concerns are growing over a shortage of certain medications. Chief Innovation Officer at Boston Children's Hospital and ABC News medical contributor Dr. John Brownstein is here with more on this. Dr. Brownstein, we're hearing about a rise in flu, COVID still going around, a surge in RSV. So if you start developing respiratory symptoms, how do you know what it is, and how do you know when it's time to go to the hospital?
Yeah, it's a great question, Diane. This is all part of the seasonal mix that we've experienced for years, the RSV, flu, rhinovirus, parainfluenza, enterovirus, and now we have COVID. Ultimately, it doesn't matter too much because most people recover just fine with rest and fluids. The data is important for public health surveillance to understand which viruses are circulating. It's really hard to determine which virus you have without a test. RSV obviously is impacting our youngest kids with wheezing and cough. Flu, has a distinctive high fever. COVID impacts, parts of the body beyond your lungs. And of course, we have the loss of taste and smell, though that's less likely with Omicron. So it's really about managing symptoms at home, drinking those fluids, moist air, over-the-counter pain relievers. And as symptoms get worse, that's when you have to call your doctor. That's when maybe an emergency room visit is important, but hopefully hold off, until it's really necessary, because our hospitals are incredibly crowded right now.
They sure are. What do you make of this figure? 78% of pediatric hospital beds across the country are full. How worried are you about that?
I'm very worried about that, Diane. It's something that we're tracking. We'll have some new numbers today, and hopefully we'll see some relief. And what's concerning is that RSV, in our kids. Now, ultimately, we're seeing a decline in RSV, which is really great news, but the decline in RSV is coming with a surge in flu. And I'm worried about the mixing of people, mobility during Thanksgiving, like we've seen for the last several years, and how that can take off COVID. Well, I think that will, be an accelerant for flu. And so I think we'll have this trade-off between RSV and flu. And unfortunately, I think our hospitals will continue to be crowded for the next several weeks to months.
Is this what we have to expect for winter now, or do you see this easing up anytime soon?
Well, this is something that we experience, every year. Being in a pediatric hospital, we experience, this winter surge every year, and we can handle it. Though what's happened this year is it's much earlier, and it's, a rise in cases beyond what we've expected. Now, with RSV, it was more than what we've seen in many years. Flu, it's also, record-breaking numbers. And then you have COVID, which is not something we've had historically. So this is what I'm worried about for the future. We need to think about rearranging our health systems to handle these surges. I think there's a lot of investment in both health systems and public health to make sure that we deal with, these cases, ultimately with vaccination, behavioral changes, right? Staying home when you're sick, masking, maybe that becomes the norm. There's ways that we can counter these surges in the future if everybody gets behind them.
All right, Dr. John Brownstein, we appreciate it as always. Thank you.
Thanks, Anne.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.